Welcome back to Good Things Utah. You've heard of celiac disease.
It's a big problem.
A lot of people talking about it.
And a lot of people say that they have it when they actually don't have it.
So how do you know if you have it or not? Dr. Pedersen is here from Utah Gastroenterology this morning. And that is a great question, right? How do you know if you have celiac?
It's a great question. A lot of people have a lot of symptoms that might be consistent with celiac disease. The symptom complex is quite nonspecific. In other words, it can be celiac disease, but can also be a lot of other things. Most specifically, or most typically, something like irritable bowel syndrome. There's a lot of overlap between the symptoms of irritable bowel syndrome and celiac disease.
You say celiac, and a lot of us think gluten intolerance. And that's a big buzzword right now, is gluten-free.
Yes, it is. A lot of people find that when they eat gluten or wheat-containing products or something like that, that they feel better. Their gut doesn't hurt, they don't get as much bloating, maybe their bowel habits are better. Can I say that about bowel habits?
Yes,
of course you
can.
I wanted to ask you, why do people think that they have these now? Is it something that's just come about in the last 10, 15 years? Because 30 years ago, our parents didn't talk about this sort of stuff, did they? Or have these issues? Or we just didn't talk about it?
Yes, celiac disease was first described, oh man, back I think in the 1800s. We learned more about it, and it became clear that it was a gluten-responsive process or a wheat-responsive process around the Second World War. But up until a few years ago, I think it was very underappreciated. It was highly underdiagnosed, and in fact, it still is. At least as far as specific diagnoses. But there are a lot of people that are hearing about it and starting to think, well, gosh, maybe that's something that I have or my child has or something like that.
Well, you know what, it's the most irritating thing, and you dump your friends after a while because you go out for dinner and they're like, oh, I can't eat that because I'm celiac. When were you diagnosed?
And that is the question.
It's just the latest diet craze, I think.
Is everyone diagnosing themselves right now?
Well, that is happening quite a bit, and I think that that's unfortunate, at least when it comes to, especially when it comes, I think, to children, because a gluten-free diet is a big deal. It's a major commitment. A gluten-free diet is much more expensive than a gluten-containing diet. Of course, for children, like you mentioned, it can be quite socially isolating, I think.
Horrible.
And so it makes a lot of sense to me, at least, especially if you're considering it for your child, to have a diagnostic process undertaken. And once the question is asked, then you can very easily get to the diagnosis. So up on the screen, there's a picture of what's called a capsule endoscopy. It's a pill that has a camera in it. And this is what we see inside the small intestine. And if you notice, the little finger-like projections there, they're very fine. Those are the villi. And in celiac disease, those villi get damaged. There's another picture that I brought along that shows what I see through the endoscope, and that's a picture of a patient with celiac disease. And although it's a different modality of imaging, you can see that those villi have been mowed down. They're not there as much. There are some kind of fissures in the mucosa, maybe a little bit of scalloping. That scalloping is more obvious in the next photo, where there are actually kind of furrows in the lining of the small intestine, the scalloping, things like that. So what we do endoscopically when we're looking for a diagnosis is we actually take samples from the small intestine. This is a photomicrograph provided by a friend of mine, Dr. Tom Abbott. He's a pathologist at St. Mark's Hospital. This is normal. And those villi, those little finger-like projections, are what we were looking at on those initial capsule endoscopy. This is a patient with kind of moderate disease where those villi are mowed down partially. Again, we have another picture of normal now. And then the next photo is a patient with severe villus atrophy or total villus atrophy.
You can see the difference.
Those villi are gone. There's also a particular type of inflammation where there are lymphocytes, and on this picture, if you look at the very dark, round, purple spots, those are a particular inflammatory cell called lymphocytes, and those infiltrate the lining cells.
So, doctor, this is what you see when someone actually comes in. What are symptoms that would make you come in, or people should notice?
So there are many varied symptoms of celiac disease. It can be all the way from normal, and we test somebody because they simply have a family history of celiac disease. People with family histories are about 10% risk of having celiac. But you may have abdominal pain, you can have severe diarrhea, very kind of large volume lots of gaseousness and bloating, discomfort. Sometimes people have iron deficiency anemia or malabsorption of other vitamins. That can happen. There are lots of different things that can happen.
The key here is, though, to get tested.
I think that's true.
So you know.
Yeah, totally.
And Utah Gastroenterology is a great place to do that. That's their website right there. You can go to utahgastro.com, or we can link you from ours, make it easy for you, abc4.com/goodthingsutah. Thank you, Dr. Pedersen.
Thank you so much for having me.
Great information. We all need it.